Hi, my name is Michelle Gittler. I don't know where I am on your row, but next to me are several of our residents and our associate program directors, so we'll all kind of wave around. Greetings from Chicago. I have my headphones on because the cicadas are so loud outside I cannot hear myself think. We are from Schwab Rehabilitation Hospital, the other freestanding rehabilitation hospital in Chicago. Schwab is located on the near west side, and amongst the many things we're really proud of, this year, Schwab was the only residency program, the only freestanding hospital to win a pretty prestigious award that celebrates humanism in medicine. It's an award through the ACGME, and I think that exemplifies what we do, who we are, and what we value, and the people that are attracted to Schwab. So when we talk about humanism in medicine, it's not just about how we treat each other. It's not just how we treat our residents, but how we treat our patients, how we treat ourselves, and what those expectations are. And I realize I didn't tell you the name of the award. It's the Baldwin Gold Humanism Award. So we are a hospital that takes care of communities that exhibit multiple issues with multiple social determinants of health, meaning there's not just one or two social determinants of health that are critical issues for our patients, but many of them, from food insecurity to housing insecurity, issues related to jobs and vocation, where they go to school, exposures to violence and adverse childhood events. And we're really proud that our patients who come from many zip codes in Chicago go home. And they go home because we take great care of them. We treat them as though they're our aunts, uncles, cousins, brothers, and sisters. And just because they have Medicaid or are is as good or better than anything else in the city of Chicago and the state of Illinois. It takes a special kind of person to come to Schwab, someone who believes in social justice, who believes that healthcare requires a heart to do it well, and who's comfortable in their skin. Because if you're not comfortable with who you are, how can you be comfortable with other people who maybe don't have everything wrapped up tidily in a package with a nice bow? I've been at Schwab for 28 years. This is my 29th year. I was not born there, but you might be wondering that. And I stay because every time I'm irritated and every time I'm pissed off, I have that patient like I had today who shows up in my clinic. We have very few in-person clinics because no one else would evaluate this gentleman who had a traumatic brain injury 2.5 years ago. So he's been in a nursing home. And I too thought this was a dump. And I walk into the room and his eyes light up and he raises his hand. And while he is not verbal, his mother, who hadn't seen him since March, but came on this visit, burst into tears because he was doing well. And we're going to admit him and get him home. That's what we do. I'm going to turn this over to Dr. Benjamin, who's our Associate Program Director, and I can see several of our residents and our chiefs on the phone or on the screen. Cheryl. I can't hear you. Can't hear you. Jason or Jack or Monica?
Yeah, hi, I'm Jason. Can you guys hear me? Okay. So we were planning to show a video for you and then do a presentation. Monica will come after me. So if I can share my screen, hopefully this video will work here.
I'm the program director here at Schwab, and I'm really looking forward to meeting you and having you learn about our program.
Hi, I'm Dr. Cheryl Benjamin, Associate Program Director here at Schwab. Welcome.
Hey, I'm Monica.
Hi, I'm Jason. We're the chief residents here at Schwab.
Thanks so much for your interest in our program. We're excited to show you what we're all about.
We are the only safety net hospital in the state of Illinois, helping patients from diverse socioeconomic backgrounds receive the health care they need.
Your PGY2 year will be spent exclusively at Schwab, working on one of our inpatient units. Check out some of our residents on service.
You'll get a good grasp of general rehab with amputees, cardio patients, and debility patients with Dr. Gray.
Come work with Dr. Mecki on the stroke service.
You'll get great experience managing patients with brain injuries while rotating on service with Dr. Kopp.
We'll get excellent training learning how to take care of our patients with spinal cord injuries here on service with Dr. Lee.
As a PGY3 and PGY4, you'll work off-site at some of our top-notch academic affiliates. Let's see what some of our senior residents are doing.
Come train in fluoro-guided pain procedures and medically complex consults at the University of Chicago.
Come train in sports medicine, including ultrasound-guided steroid injections and PRP, here at the University of Illinois, Chicago.
Come complete 200 EMGs with Dr. Mercurio and me at Schwab.
Not only do we focus on getting great education here, we also strive to create a culture of family.
Oh, hey, welcome to the resident room. Here, let me show you around. As a PGY2, this will be your workspace. We work hard here, but we also try to have a little bit of fun. We get a little hungry too sometimes, so thanks to Dr. Gittler, we have a monthly Costco fund.
Ooh, lentils and Pop-Tarts, breakfast with champions.
We're hopeful that now you know that you'll get an extraordinary education here at Schwab.
We hope to see you soon. Welcome to the Schwab family.
Welcome to Schwab.
Schwab.
Welcome to Schwab.
Welcome to Schwab.
We are Schwab! Welcome!
So we're sad that we can't have you all come see us. Looking at residency programs this way is kind of like trying to figure out if you like the food in a restaurant by reading reviews. You know, you don't get the same flavor, and it's really hard to know which burger is the best and which French fries are really good. But we do hope that you get the idea that we're a program that values diversity. We value the communities we care for. The training's extraordinary. And we're really proud that our residents have gone off to do whatever they've wanted, whether it's matching into fellowships, going directly into private or academic practice, moving across the country. They've practice the kind of medicine they want to practice and in the places they've wanted to go, because they've been well prepared to do just about anything. We tell them if you haven't seen it at Schwab, the likelihood is it probably doesn't exist much anywhere. Cheryl or Monica?
Yeah, I wonder if that's Monica trying to talk. Monica, maybe try one more time.
That is Monica. Well, while we are playing with our challenges, I didn't know if there are questions that offhand people wanted to start to ask about Schwab or Chicago or the match or the academy. The question is there any exposure or experience to hospital administration? I'm assuming you mean administration, healthcare administration. And one of the things that we're really proud of is we do have residents on all of our hospital-based committees, including operations and quality. Our vice president is available to the residents at all times if they are interested. We do have and are working on adjusting our both junior attending rotation and our exposure to subacute level care outside. Part of that includes administrative processes. The next question is if there are any community outreach opportunities. There are multiple. And Monica, does your volume work now? Did I hear you?
I can hear you very quietly, Monica.
How about now?
That's better.
Yeah.
All right, sorry for my volume, but I'm gonna just run through this really quickly. So welcome to Schwab. Is that better?
Yes.
So as Dr. Gittler said, we're a freestanding hospital on Chicago's west side. We have 92 inpatient beds, and we also run an outpatient clinic, physician clinics, as well as therapy, physical therapy, occupational therapy, and speech therapy. Our hospital affiliation is the Sinai Health System, and we're a referral source for over 50 hospitals in the Chicago area and the surrounding counties. We are a 3-year advanced program accredited by the ACGME, and we have 5 residents per class. Our academic sponsors, we have 2 of them, the University of Chicago, as well as the University of Illinois, Chicago. And so you'll get experience with both of those programs.
Yeah, 5 minutes remaining. 5 minutes. Yeah.
During your PGY 2 year, there's 5 rotation blocks in which you'll spend 10 weeks on each block. You'll be working one-on-one with your attending. You'll have a faculty mentor, as well as you'll be mentoring medical students. And you'll be participating in some hospital committees as well to get you really involved in what we do at Schwab. As you can see here on the rotations, those are the different specialty services and dedicated rehab units that we have that you will spend 10 weeks on each of those services. During your PGY 3 year, those are 10-week blocks, 5 in total. And this is primarily outpatient work. So you'll spend some time with our affiliates at North Shore doing consults, inpatient consults at the hospitals that you see listed. You'll get extensive experience in interventional pain during procedures, electrodiagnostic medicine with our faculty members, as well as sports medicine, where you'll get lots of experience doing different procedures, musculoskeletal procedures. During your PGY 4 year, there's a lot of flexibility in that year to really sharpen your skills and decide what you want to do and how you're going to be a great physician. And so you can see the different rotations that you'll participate in as a PGY 4. more experience doing inpatient consults. You'll have experience in a supervisory role as a junior attending, and then other experiences as you'll see here listed. I apologize, I'm trying to move fast. In terms of the education, we have protected time in our lectures from 8 to 11. A little bit different right now with the COVID, but that's what we're doing for our dedicated lecture time. And it's an 18-month rotation. So you'll run through everything twice. Lunch and learns are every day for our PGY2s. We have monthly journal clubs, grand rounds every month, self-directed study, as well as participation in different academic societies like AAP and PM&R. Every PGY3 is required to do a quality improvement project. You will participate in our anatomy lab at the University of Chicago. We partner with Shriners Hospital and do a gait lab with our pediatric hospital. We do our self-assessment exam every year, and we also do the EMG self-assessment exam every year too.
2 minutes.
Great benefits, 15. So in the interest of time, you can see what our education benefits are. And then this is our call schedule. It gets greater later. So 15 calls when you're a PGY4 and no weekends. I mean, you just can't beat that. This is our fantastic faculty that you'll work with. And these are our fantastic residents who are on the call and can answer any questions that you have. Like us on Facebook. We have a lot of fun. And we welcome you to Schwab. Any questions?
Well, thank you for your time. Any one of us you can email at our name with a dot, first name, last name, at sinai.org. And my email is in there. I can forward it to the residents if you have questions.
Thank you, Dr. Gittler, and all the representatives from Schwab. Really appreciate your time.
Thank you. Thanks for doing this, by the way.
Of course. Next,